So, welcome everybody. Happy Thursday. Today, we're going to talk about, well, of course, this is the Barton webinar, fixed blood sugar webinar. And I'll do the intros quick. I'm Joe Barton. Hello. And we've got
I'm Scott Saunders.
Dr.
Leslie.
Scott and Leslie. All right. And we're good at waving. Can we do this is the parade wave for princesses. That's probably really not a good look on me, but all right. Well, thanks for hopping on, everybody. Looks like we've got a full capacity almost here today. So great to have you joining us. This is the webinar today. So this is the week where we talk about a different topic that is related to type 2 diabetes, but is not 100% full-time all type 2. So today we're going to talk about wound care. So, and I want to get into wound care because I know people with diabetes are more susceptible to wounds and then to the slower healing of wounds. But I also just want to cover this as a topic in general. Well, a big reason. So just on Sunday, my wife and I were at church and we met a new friend of ours. She's 20-year-old young lady who had her foot amputated a couple years ago, and then it had complications, and she had to have a higher up amputation of her lower leg as well. And it just was, it felt like it was a God connection. So I connected her with our friend Chris, who we've gotten to know this past year. He's also had a lower leg amputation, and we're in the process of trying to help her with that. But I thought, wow, how timely to do a webinar on the topic of wound care. We just talked about that last Thursday as a possible topic because it came up before that. So, so I thought, today would be a great time to do that. So, Dr. Saunders, I'm going to turn it over to you, and you could just dive in. And if you want to start off with our disclaimer as well, and then let's just get into it.
Okay, so remember that whatever information you get here is information. It may apply to you and it may not apply to you. So use good wisdom and good judgment in whether you apply it to yourself. And sometimes you may need help with that, like working with your doctor or healthcare professional to decide if that's right for you, if that's something that you need. Wound care is not something for everyone. It's something that everyone who has diabetes better look into and know about. This is something that is one of the bigger problems with diabetes. People who have long-term diabetes, but you can start getting wounds even before your blood sugar is elevated. You can get swelling of your legs. You can have phlebitis or inflammation of the veins. And so the blood doesn't return very well. And you get relative what's called hypoxia. Hypoxia is low oxygen levels. And that's because the blood isn't circulating very well. And you have to think of when you're standing up, all of that blood in your arteries goes downhill, and now it's got to get from your feet all the way back up to your heart. And there's no pump down at the bottom going pump, pump, pump to get your blood from your feet to your heart. So what the heck? How does the blood get back up there? And the amount of pressure on there is according to how high the column of blood is, right? Or water, whatever, liquids. So you could have a lot of pressure, between your heart and your toes, pushing down and preventing the blood from getting back up to the heart so it can circulate. Circulation is the important thing we're talking about here. So instead of having a heart, the body has an amazing, just miraculous way of doing it. And it's so It's so well done and so perfectly put together. And that is every little bit, every few inches or so, there is a valve inside the veins. And this valve lets the blood go up, but it can't come back. So the valve is like letting it up, but can't come back. So what pushes it up? Because it only has to go now, instead of from the heart to the toes, it only has to go this far. So, but what gets it that far? Well, it doesn't require a lot of pressure. So all you need is a little bit of pressure, and movement is what mostly does that. So as you're moving around, your muscles are massaging your your veins, and it doesn't require a lot. Just a little pushing against the veins pushes the blood up to the next level, and then up to the next level, and then up to the next level, and then up to the next level, and it just keeps going like that, pushing up, pushing up. And so it isn't a whole lot of pressure from one level to the next, and that's how the system works. So that you don't have to have a huge amount, like a big pump down at the bottom to push it up. So how do you get these ulcers, these wounds, and these circulation problems? It's because there isn't good circulation. Now, remember, we talked about this when we talked about neuropathy. When the nerves don't function, it's because there's not enough blood getting there. That's hypoxia. It's the exact same problem. So it's not because the nerves are damaged, you get the wound. It's because you have hypoxia, because you don't have good circulation, you get nerve damage and you get wounds. So why the wounds? Well, the skin has cells that are growing at a very rapid rate. They're reproducing at a rapid rate. When they're not getting blood, and they're not getting nutrients, and they're not getting oxygen, then they don't reproduce at a rapid rate. So all it takes is a little cut, a little tear, too much pressure, and they're not getting enough oxygen, and some of the cells die, and then you have a hole, and now you don't have enough oxygen, you don't have enough to repair that hole. So the hole can get bigger and bigger and bigger, and it can last for a long time. And then you have this open wound, and what happens next? Bacteria start growing in it. So now you've got infection on top of an open wound, on top of not having enough circulation and hypoxia. So how in the heck are you going to cure that infection when you don't have any blood flowing to it? Is that going to happen? No, it's not going to happen. So in the wound care centers where I work in one place is a rehab facility, and then we send them to a wound care center, and they work on the surface on dressing the wound. So dressing the wound, dressing the wound, dressing the wound every day for years. I had a guy for 2 years. They dressed his wound every day. They dressed his wound. They dressed his wound. They dressed his wound every day for 2 years. Finally, he said, "Forget this noise. I'm tired of this." The other guy that was in here down the hall, he had his leg chopped off and got an artificial limb, and he's up walking around, running around. That's what I want. So he actually had an amputation by his own choice, so that he didn't have to have that wound change every day, every day, every day. He chose to have his leg chopped off, his foot, his lower, below his knee. And then he got a prosthetic foot, and now he's up walking around. But there's an issue with that, and that his other side now has a wound on it. And so what are they doing? Dressing the wound, dressing the wound, dressing the wound, dressing the wound. They're not dealing with the underlying problem. What the heck? There's a circulation problem here. And just dressing the wound and dressing the wound, it didn't work on the left side. Is it left? Yes, his left. What makes them think it's going to work on the right side? And so it's the same issue over again. So then he's going to end up with two problems. So you need to know this. This is not something that you're going to find just anywhere. This isn't something that even specialists in wound care are going to know about, because all they know is dressing the wound, dressing the wound, dressing the wound every day. That's all they know. So here's what you do for wounds. Number one, circulation. Get your blood sugar down to normal. Get it down to normal. Take the synochroma to help with that, to make sure you have enough of like the minerals and vitamin D to help the wounds heal. And take Nervala. Nervala, remember, we were talking about this when we were talking about the nerve problems when people had neuropathy. How does Nervala work? Well, one of them, alpha lipoic acid, works directly on the nerves. Okay, that's an anti-inflammatory for nerves. But there's another one in there called benfotiamine. And benfotiamine works on circulation. And it's not the big circulation, because you can feel your pulse. Yeah, I got a pulse. But that doesn't mean that you're getting blood to it, because the problem in diabetes is microcirculation. And that's the little teeny arterioles. And those arterioles have muscles in them. And when they're all ratty and they clamp down, the muscles close down, and then you don't get circulation out the other side. So what the benfotiamine does, it's a fat soluble vitamin B1 that gets in and helps repair the lining inside those arterioles, so that they can no more have inflammation. They're not all ratty anymore, or dying. The cells dying. And so that vitamin B1 repairs the lining so that the circulation starts flowing again. So you're getting oxygen to it. That's how it repairs the nerves. Well, guess what? That's how it repairs the circulation for healing wounds as well. So, so number one, circulation. So get your blood sugar under control. And that is phase one of the program. Get on the program, do it. Phase one. I had someone just this morning, the first patient I saw this morning, calling from San Diego, and he's like, okay, he needed help because he has type 1.5 diabetes. He has type 2 diabetes with insulin resistance, but he also has type 1 or almost type 1, where he only makes a little bit of insulin. So he says, I don't want to go on insulin injections. So he went on phase one of the program of the diabetes solution kit. And while he's in phase one, his blood sugar was averaging over 300. Now it's down right around between 100 and 200 all the time. And that's even though he has a lack of insulin, he's still getting not quite normal yet, but a significant improvement in his blood sugar. So go on phase one, get that blood sugar down to normal. That is a really important thing, so that you can repair your arteries and not have that high blood sugar all the time. So number two, exercise. Too many people are, my foot hurts. I have numbness in my toes. I can't walk, and they sit. And there's something that sitting does. When people fly in an airplane, in those flights that are 8 hours or more, 10% of the passengers in that airplane will have clots in their veins. The circulation is not good when you're sitting for long periods of time. Sitting especially pushes against the one vein. There's one vein behind your knee called the popliteal vein. And if you compress that, then all the circulation down below it isn't going to flow very well. And so it just sits there. But the arteries will push blood down, but it's really hard to get blood to come back because that one vein, there's only one behind your knee, a popliteal vein is squished. And if you're not getting up periodically and running around and getting that circulation going, then you lose that circulation. And then number two, every time you exercise, when you're using your muscles say, hey, I need more oxygen, right? Because they're working. And when they need more oxygen, guess what? it opens up the arteries and allows more blood flow to the muscle, but also to the circulation of the whole leg. So you get more circulation. If you'll notice, when you're doing heavy exercise, your skin turns red. Why does it turn red? Well, because the blood vessels dilate. And that means you're letting more blood into that area. That's exactly what wounds need to heal, right? So, number one, get your blood sugar under control. Number two, take the right supplements. Number three, exercise properly. The circulation, those three things will help the circulation more than anything else. And then everything else you do is ancillary. What does that mean? Well, it turns out sunlight helps a lot. So if you can allow the wound and like the lower limb to be in the sun, it doesn't have to be a long time, 20, 30 minutes. That's all. You don't have to get a sunburn. Just having that infrared light, and they actually make these, and they're really expensive. They make these pads with a whole bunch of LED lights in them, and you can wrap them around a leg or something. And those LED lights are red. I don't remember how many nanometers, 512, no, 3. Anyway, that red light is penetrating, and there are certain proteins in the mitochondria that are making energy that are stimulated by that light. And they turn on and start things working inside, in the skin and under the skin. So having sunlight will help. That's ancillary. We have a place here that uses hyperbaric oxygen. And hyperbaric oxygen can be helpful as well if you have access to that. And then here's something very interesting. So remember I said you're going to get an infection because that you have an open wound, and it's an open wound for a long time, and there's no circulation, so you don't have any antibodies and you can't fight that infection. And so the best way to prevent infection is Manuka honey. Not just any honey. Manuka honey is grown in New Zealand, and it's been tested, and it has certain ingredients in it, certain substances in it that inhibit bacteria. And you think, well, Dr. Saunders, that's stupid. I have sugar diabetes, and my blood sugar is like 300, and I'm going to put honey, sugar on my wound? Well, yes, actually, it works really well. We use it all the time. I use it on my patients in the nursing home who get wounds, even if they have diabetes. And yes, it's helpful, even if you have diabetes. So it does seem paradoxical, but really the purpose there is to allow fibroblasts to come in, and fibroblasts are what make the tissue in the cells, the keratin to make scar tissue, and collagen to put everything back together. So you need those fibroblasts, and sugar does that. I don't know if you've ever heard of prolotherapy, where people inject a joint that has a lot of arthritis in it with what? With sugar. And then the sugar tells the fibroblasts to come in and repair the arthritis in the joint and repair the cartilage in the joint. It's called prolotherapy, and it works really well. So putting that Manuka honey on, and you put it, you kind of just fill the wound with it. You know, I use a little stick, one of those tongue depressor sticks, and just fill the wound with it. And then put one of those like Telfa with the plastic pads on it over the top. And then wrap it. I use vet wrap, but I usually put a pad over the top of that, and then use vet wrap and leave it for a whole week. Don't even look at it for a week. You just got to leave that honey in there, let it be there, and then when you take it off, go expose yourself to light in the sun. But meanwhile, you're exercising, right? And you're keeping your blood sugar back, getting your blood sugar normal. And then supplements. So I think we covered everything. Did we miss anything, Joe?
No, I think that covered everything. So that reminded me, I had heard I think my mom used to talk about when people would have bed sores in the hospitals, that putting table sugar on their wounds or something. So it's probably similar, but I would imagine that the Manuka honey is just better, and it sticks better as well.
Well, yeah, the plain old white sugar is, again, it brings the fibroblasts in. And the advantage of the Manuka honey is because you have poor circulation, that you're going to get infections. And the honey, this particular honey, prevents you from getting infections. So yeah, if you have a bed sore and you don't have poor circulation necessarily all the time, then table sugar, yeah, that's been used and it works.
Yeah. So you talked about infection, and so the friend that we just met recently has had a fever of about 100, which is probably saying there is an infection going on, and she's had trouble with her wound not healing. But can you talk about the bone and the bone connection to that? Like, if the bone is infected, how do you know, and what do you do about that?
Okay, yeah, that's the bone infection is called osteomyelitis, and what happens is you have this area. It's an open wound, and you've got blood there, and you've got everything a growing bacteria needs. Right, it's the right temperature. It's got protein and carbohydrates and fats, and everything that bacteria needs starts growing in there, and then if it penetrates into the below the skin, it can get into the bone. And this is common around areas where the skin is thin and the bone is close. So if you think of like the shin areas, or on the foot, there are several areas on the foot where it's easy to get osteomyelitis and get the infection into the bone. And the reason why is because you don't have good circulation, even internally. So there's not enough blood, there's not enough immune system to fight off that infection. And bones are usually very well protected from infection. Remember, your bones are making the white blood cells. They're making your immune system. And inside the bones, the bone marrow, that's where it's all made. So they're very well protected. But if you don't have good circulation, then that's when it gets into the bone. And that is very difficult, if not impossible, to heal. Unless you can improve the circulation, you're not going to heal a bone infection. Okay. You're not going to heal osteomyelitis.
And how do you discover if you have a bone infection? Is that through an MRI?
Yeah, MRI is the best way.
Okay. Yeah. Well, this has been really good. So recapping what you said, so circulation is number one, and getting your blood sugar down. Phase one of the program for the diabetes solution kit is getting your carbs down to 20 grams or less per day, which is like basically almost zero carbs, and getting rid of any excess sugar stored up in your cells. Supplementing with Synachroma and Nervala, which is good for the blood sugar, insulin resistance, and nerves, neuropathy. And then exercise is the third big one. And yeah, that's great. So, and then you talked about ancillary sunlight, infrared, hyperbaric oxygen, Manuka honey, and prolotherapy. So awesome. Great stuff. Really appreciate it. I'm going to turn things over to Leslie because I know we have a lot of questions that have come in. So thank you. Today's Fixed Blood Sugar webinar is sponsored by Synachroma, our best-selling advanced blood sugar support formula. Now, thousands of people around the world are taking Synachroma every day as part of their program to fix their blood sugar using natural ingredients that simply work. Now, Dr. Saunders formulated Synachroma to meet key nutritional deficiencies that most people have unknowingly suffered from for far too long. With Synachroma, you get a blend of 6 key ingredients. The perfect combination of chromium, vitamin D3, and vitamin K2, which it's important to take those two together, selenium, vanadium, and our 10-to-1 cinnamon bark extract. Now, if you're not already using Synachroma, I highly recommend that you give it a try and see how it helps your energy, your weight, and your blood sugar numbers. You can get Synachroma at bartonnutrition.com or on Amazon. If you get it at bartonnutrition.com, you can enter the coupon code webinar25 and you'll save 25% off at bartonnutrition.com. But I realize some people like to go to Amazon as well. So anyways, Synachroma, highly recommend. Now let's get you back to the Fixed Blood Sugar webinar.
All right, lots of questions. You just mentioned exercise. I know that was a question that came in. Do you have recommendations for an exercise program or exercises that someone should maybe look into?
The problem with having an exercise program that everyone can do is everyone can't do it. So it's what you can do first of all, but ultimately it's what you like to do, because if you don't like it, you're not going to continue doing it. So I don't particularly like swimming. My wife loves swimming, so she goes out and swims. She'll go out in the ocean and swim, but I don't particularly like going out in the ocean and swimming. But I got a stand-up paddleboard, so I can paddle around and around her as she's swimming in the ocean. And I like my exercise, and she likes her exercise. So I can't say that one is better than another. However, just sort of as a general rule, it doesn't take a lot. If you're doing high intensity interval training, HIIT, that what that means is you don't have to sustain it for a long period of time. You don't have to run a 100-yard dash. Just run for 10 seconds and then walk for 30 seconds, and then run for 10 seconds, and then walk for 30 seconds, and then run for 10 seconds. And if you do that for about 10 minutes a day, that's adequate, right? And you only have to do that 5 days a week. So 5 days a week, 10 minutes a day. Who can't do that? That's simple, right? But if you like to change it up, well, great. Pump as much iron as you can for 10 seconds, and then let it rest for 30 seconds, and then pump as much as you can for 10 seconds, and then do sit-ups as fast as you can for 10 seconds. So the idea is to push really hard for a short period of time, because getting your muscles up to their max is the way you improve. But my max is going to be different than Leslie's max, is going to be different than Joe's max. So for each of us, it's going to be different, and which exercises we choose to do are going to be different as well.
Is the goal to get your heart rate up, or to use the muscles, or what's the goal?
To use the muscles, to strain the muscles to the point of this is all I can do, and doesn't have to be a long time. This is just all I can do.
Great. Okay. Question from David. I more or less followed your recommendations, and my last A1C test was 5.7, down from 9.6 5 months ago.
That's awesome.
Yes, it says I weighted 100 kilograms, but now, I weigh 100 kilograms, but now weigh about 85 kilograms. So if you could do those conversions. And then he has two questions about that. So number one, not sure if it was from fat loss, but I have gallstones, cholesterol deposits, which got infected, and I need my gallbladder removed. Is this a possible consequence of a keto diet?
Well, yes and no. Yes, it's possible. As you change your metabolism from what you're eating, you're going to be recycling your bile acids. The bile acids are what helps you digest your fats, right? And so if you're eating a high fat diet, you're going to make more bile acids, number one. Number two, if you're on a ketogenic diet that doesn't have a lot of fiber in it, then you're going to be reabsorbing those bile acids, and it's the secondary bile acids that cause those stones. So that is sort of the picture of, yes, that kind of a diet could contribute to the production and increase in stones. So your weight was 100 kilograms is 220 pounds. and then you're down to 85, which is kilograms, which is pretty close to 180, 190. So you've lost 20, 30 pounds, and your hemoglobin A1C is now out of the diabetes range and into the pre-diabetes range. So that's quite a drop. That's like excellent. Good work. Good work. Yeah. So that's why it's one of the reasons, so that everybody needs to know this. If you're doing a ketogenic diet and you're on the program, remember all the free foods. Don't forget the free foods. All the kale and the spinach and the celery and the broccoli and cauliflower, all of that stuff, it's free. And people who eat their bacon and bacon, sausage, and cheese omelet and drinking cream, that's fine for a ketogenic diet. But man, kidneys or gallstones, and I don't know. It's so much better to have a lot of fiber.
Okay, and his second question is, my blood sugar was down to around 90 most mornings, but with the gallbladder infection, my blood sugar went crazy. Now around 250 in the mornings. Yeah. Should I temporarily increase my diabetes medication? I had gotten it down to 2 milligrams or 500 milligrams of metformin. No. Okay.
No. Actually, you know what? That happens because you release, when you're infected, you release a bunch of stress hormones, cortisol. And because of all the cortisol, it makes you resistant to insulin. So of course it's gonna jump way up. That's okay. It's okay. Don't worry about your blood sugar. There's a reason why the body does that, because you need that extra sugar in times of stress, and infection is a stressful thing. So yes, you if it's infected, you got to get your gallbladder out.
Can you remind me, Dr. Saunders, when you get your gallbladder out, what does your gallbladder do, and what do you have to be careful of after that?
Oh, that's good. Good question. Okay. So the gallbladder is the storage of bile acids. And I just told you that bile acids are what helps us to absorb our fats. So if you don't have bile acids, then you don't absorb fats. And so here's sort of a conundrum. You have the livers making these bile acids, and it's just like soap, right? Soap makes fat soluble in water, makes oil soluble in water, right? So you're eating stuff that has oils in it, and you're eating an avocado. There's a whole bunch of oil in avocado, but everything in your stomach is a water soluble environment. So how do you make that fat soluble? Well, the body takes these bile acids, soap essentially, and then can take all these fats and make them water soluble, and then it allows you to absorb the fats. So you have this gallbladder that's full of the bile acids, and every time you eat a meal, it goes squirt and squirts the bile acids into the small intestine and the duodenum. And then that's supposed to mix with the fats and combine with the fats so that you can absorb the fats. And you absorb some of the bile acids too with it, of course. If you don't have a gallbladder, now you've had your gallbladder cut, and you have the liver is still making those bile acids, but instead of making and trickling and putting them in the gallbladder for storage, now there's no storage, so it just goes out and it's those bile acids are stored in the duodenum and the small intestine, so that as you eat, it can still work well. But some people just don't tolerate fatty meals. So if you eat a high fat meal, something like pizza, a lot of cheese, or a lot of meat, or a pork rind or something like that. If you're eating something high in fat, you may not tolerate it if you don't have a gallbladder. And some people take what's called an ox bile extract. The ox bile is a pill that is actually bile, and you're taking that as a pill so that you could make the fat soluble and you can absorb them. And people have different responses depending on on how much bile their liver's making. How often you eat makes a difference. How much fat you eat makes a difference. How much fiber makes a difference. So all of those will change how the fat is solubilized and absorbed.
So in our healthy gut support, we have probiotics and digestive enzymes. And one of those enzymes is lipase, I think it's called, and that helps to absorb or digest the fats. Would that be helpful for someone?
Yes. Yeah. In some cases, that will be helpful because then the pancreas should be making the lipase, but if not, then having that the triglycerides broken down, it was helpful. So, and they can be absorbed then.
Okay.
All right. Question from Kathy. About a year ago, I began going through an intense time of stress. I lost a lot of weight, including leg muscle in the calf. Recently, I can hardly walk. I'm 52 and I walk like a 90-year-old. I can no longer do steps without painfully pulling myself up. I walk every day as I can, but the weakness makes my balance bad. I'm so scared of losing use of my legs. Is there something else besides walking I could be doing to restore strength?
Okay. Thank you for that. This is really important. When you have a problem, before you look at treatment, what am I going to treat this with? So pain in the calf, along with shrinking of the muscle, that could be denervation, where the nerve isn't getting there anymore from a pinched nerve in the back, for example, or something in the leg, or diabetes, a neuropathy kind of thing. The neuropathy usually starts in the toes, so something in the calf. What else? Clotting in the arteries or veins, or some kind of clot that is blocking the circulation. So you get the same kind of thing, not enough oxygen there, and it cramps up and it hurts and all of that. So number one, and I hope everybody understands this, number one, find out what the problem is first. So you need tests. You need to know if your arteries are patent, if your veins are patent. You need to know if your nerves are working. The neurologist can do a nerve conduction study. A vascular surgeon has usually ultrasounds that they'll look at the arteries and the veins and see if there's a lack of circulation. There's something missing. You may need to see a neurologist. You may need to see a vascular surgeon. Find out what the problem is, so then you know what to do about it. Because just walking around, if you don't have any circulation, exercise is wonderful, but restoring circulation might be more important.
Okay. We have a question here. What can I do to make my body more alkaline? Right now, I'm very acidic.
Oh, that's interesting. I was just talking to my son about this the other day. So a lot of people will use, they'll drink alkaline water, for example, to make their body more alkaline. And that's kind of, that's not the best way, because that doesn't address the whole metabolism. It only addresses one small portion of it. And I know of one study that was done in diabetics with early kidney disease. They were taking a half a teaspoon of baking soda in water to alkalinize their body. And it did. The ones that took the baking soda had much less progression of their kidney disease than the people who were not taking the baking soda. So it's possible that you could just take like the alkaline water or baking soda or whatever and see improvement. There's been a lot of research done on that by the companies who make the alkaline water, for example. But overall, it's still much better overall in the big picture to eat foods that make your body more alkaline. So what makes your body more alkaline? Well, higher in fiber, lower in fat, lower in carbohydrates. When you're processing extra carbohydrates, you make acids, and then the fat makes fatty acids as well. And your body becomes more acidic. So having things like kale and spinach and celery, and instead of alkaline water, there's one group that I know of, people that I know of, that drink 16 ounces of celery juice every morning. And that'll help a lot to alkalinize your body. It makes your enzymes more efficient. Things function better. You make the energy more efficiently. Other fruits and vegetables actually work better to alkalinize the body.
Okay. Another good question here. Denise said, how often should you take the iodine supplement, daily or weekly? And what foods do you suggest that have iodine? Joe, do you have any iodine on hand that you could show right now? Oh, you're not in your office.
Yeah, I'll go grab some.
Okay.
Iodine. Okay. So iodine is a salt. It's kind of like sodium or potassium, or it's a salt mineral, and it's really easy for the body to assimilate iodine. And so if you're taking the iodine drops, 1 dropper full a day is fine. We did not make this for weekly dosing, although you could do it weekly. It depends on how much you're getting in food. The problem in the United States is because the soils don't have iodine, it's not in the food. So unless you're eating seaweed and kelp, you're probably not going to get much iodine, if any at all. So those seaweed chips, those boxes you get at Costco of the seaweed chips, 1 box is 5 milligrams of iodine. That's a significant amount. That's more than you get in 1 dropper full of a day. So if you were to eat 1 of those boxes a week, that would be enough iodine, plenty of iodine that your body would need. We formulated the liquid iodine that we have, so it doesn't have any flavor. It's not the deep red stuff and makes everything taste weird. You can put it directly in your mouth, or you can put it in juice or something, and 1 dropper full a day is just fine.
Yep, here's what the bottle looks like. It's actually pretty small, and it's in I think it's hyaluronic. I forget what color the bottle is, but it's a glass that keeps this intact for many years, so it'll last a long time on the shelf. But yeah, you can just, I don't know where my droppers are. I just take this and dump a little bit in my water glass.
I do the same. Maybe we shouldn't tell people that, but that is what I do.
You know what? You guys, it doesn't matter that much. I mean, even if you dump too much, so what? Instead of getting 1 milligram of iodine, you get 5 milligrams. Big deal. It's like, that's like eating 1 of those things. You can't overdose on this. Yeah. In fact, when we do a test to test somebody for iodine, we give them a pill with 50 milligrams of iodine in it, and then we collect their urine for the next 24 hours, and they should excrete, and we should find in the urine almost all of that, like 49 milligrams of iodine. And if we find 48 milligrams of iodine in their 24 hours of excretion, then that means they didn't have enough iodine.
Your body absorbed what it needed, and excreted the rest. Okay.
Yeah.
Cool.
Okay.
We had a question on vibration plates. What do you think of vibration plate machines? That's for like the exercise part. Good.
I think they're awesome, and they're really good for preventing falls. They're actually getting your nervous system used to being unstable, so to speak. So the idea of the vibration plate, it's random vibration that's supposed to make your nervous system sensitive to changes, which is really good for preventing falls. If you think about it, you're standing up straight and you're looking somewhere. How does your body stay up? Because you're not necessarily watching where you are all the time. It's the sensory nerves in your feet. And those vibration plates, the random vibration plates, are really good for that. That's one of the reasons why I do stand-up paddleboard. It was really hard for me at first, but now I'm getting really good at it. And that means that my nerves, proprioception nerves in my feet, are working better than they were before.
Okay. Gregory says, I found out I have a squamous cell carcinoma lump to be removed. Is there anything are there any supplements from Barton that I should be concerned about along with this wound care?
Okay. Squamous cell carcinoma is a skin cancer. It's from sunshine. And it wasn't the sunshine that you got yesterday or last week. It was the sunshine that you got 30 years ago when you burned, when you were a kid on the sand or whatever. It takes a long time for that to develop. So it doesn't spread to the rest of your body as a rule. It just grows locally. So you have the local removed but they have to make a large wound around it. It's usually on the face, but it can be on shoulders or hands or anywhere the sun shines. The wound, as far as the supplements go, it'd be a good idea to use Nervala. That would be a good thing. It would be a good idea to use Synachroma as well, because that's going to help the blood sugar be more stable. Everything we talked about would be good, and having extra iodine probably won't make much of a difference, and magnesium probably not much of a difference. Really, just those two are the ones that would help the most.
So speaking of supplements, you can get 25% off by using the coupon code webinar25 when you go to bartonnutrition.com. So just put that promo code webinar25 in the when you're checking out, and you'll save an additional 25%.
Can I tell you something I learned about squamous cell carcinoma?
Please.
This is really interesting. There is a cream, and I've had patients use it for many years. It's an extract of eggplant, and it came from Australia. They did some research on it. And they did the research in England, showed it was 100% effective against squamous cell carcinoma and basal cell carcinoma. So non-melanoma skin cancer is what they call it. And it's a cream that you just rub on, put a Band-Aid over it and leave it. And every day you peel the Band-Aid off, put more cream on it. And you never have to have surgery. It'll take the basal cell carcinoma. The problem with basal cell carcinoma is it's growing under the skin, and this is the part you see, and this is the part you don't see. So if you just cut out the part you see, you have this basal cell carcinoma still left. So they take a big wide margin all the way around it to make sure they get all of it. But if you use the cream, you don't even have to do that. You just put the cream on. And what's really cool about it is it gets rid of the cancer cells. It kills cancer cells, but it doesn't kill normal cells. So you're left with the wound of all the cancer cells are gone, and then it fills in with the normal cells. And I've seen very large ones. Well, not my patients, but pictures of people with very large ones who have completely resolved with just the cream without having surgery at all.
Wow.
So that's an option if anybody comes up with one of those two, squamous cell carcinoma, basal cell carcinoma. It's called Curaderm, and it's an eggplant extract.
Wow.
Is that a prescription
No.
only? No,
you get it on Amazon.
Okay.
Yeah.
Might want to get that while you can, because
Yeah.
products with the word cure of stuff like that don't typically last too long on the market.
I don't know. It's been around for 15, 20 years.
Wow. Okay, well, that's good. Yeah. Huh. Well, that's cool.
Okay, we have some questions from Samuel. Number one, may I know what else to do because after taking 1.5 bottles of Niagara XL, there's still inflammation during urination. And then he has a couple other questions as well.
Yeah. So we're back to sort of the issue, and the main issue when you have a problem. Before you think of treatment, think of why. Why is that there? What's causing it? Because if you have some kind of chronic infection, if you have like a yeast or something like that, Niagara is not going to help that kind of stuff. If you have some, I had someone recently with cystitis, which means an inflammation of the bladder because of allergies, and she was resistant to histamine, or she had excessive amounts of histamine being produced, and so that goes into the bladder, and then the bladder gets really upset about that, tender, and so there's a lot of different reasons why this kind of thing could happen, and it's a good idea to find out why first, and then look to treatment.
Okay. He also says it's very difficult to avoid sugar because it's in almost every food in Malaysia. Kindly advise.
Okay. Water doesn't have sugar in it. If you get a whole potato, it doesn't have sugar in it. But it does have a lot of, okay. But anyway, sugar. If you get green vegetables, if you get fresh fruit and vegetables, there's no sugar in any of that. If you buy the meat, there's no sugar in that. So think about this. If you don't buy anything that comes in a package or is pre-made for you, then you don't have to worry about it because there's no sugar in anything there. And you'll be much better off. You'll be much healthier anyway. So because the prepared foods are not good for a lot of different reasons besides just having extra sugar in them.
Okay. And the third question is, let's see, is it okay to take a drink with caffeine for men's health? I think is caffeine okay?
That's really interesting. So coffee, tea, people have lived on that for centuries. And so there's been a lot of research on it. And really, there's never been a study that shows caffeine is bad for you, except people who get anxiety. So if it causes palpitations of your heart and you get sweaty and anxious and nervous, then yeah, don't drink coffee. But it's generally not good for people who have too much adrenal output. So people who are stressed or a high stress or a high adrenal output. But I can't say anything against it, that it's bad unless it's bad for you specifically.
I used to have issues with caffeine, but that was before I worked out regularly and my back would go out and stuff. And I think it was connected to caffeine as well. But I think even more so it was because I wasn't exercising. I wasn't, working out my back muscles and shoulders and things like that. So that made all the difference for me as well. But another reason to exercise.
Yeah,
it
that's
also
great.
depends on the amount of caffeine that you're drinking as well.
Yeah.
Mason says, does K2 help with circulation?
K2 is an amazing vitamin that does a whole bunch of things in the body. And the way it helps with circulation is by taking the calcium deposits out of the arteries. So here's the way. This is so cool. The body's so miraculous. So we think of like our heart is beating to push the blood throughout our bodies, right? And that the arteries are just pipes. So the heart is pumping, pushing the blood through the pipes, and the pipes bring it to our, but that's not the way the system works. It's so much more dynamic than that. As the heart beats, the arteries are expanding to allow the blood in. And then when the heart relaxes, the arteries are closing down to push the blood through. So you have this going on all the time. And that's what keeps your blood pressure normal, and it keeps it in a range. If all you had were actually hard pipes, then every time you'd pump, you'd get a really high pressure. And then every time your heart relaxed, you get the super low pressure. So you go high, low, high, low, high, low, all the every heartbeat. But the system is made so that it keeps a blood pressure in a range, 120/80, which is not really a wide range. It's kind of a narrow range. So what happens if you get arterial sclerosis is you get hardening of the arteries, and you get this very high, low, high blood pressure systolic and low diastolic. Vitamin K2 takes that calcium out of your arteries and puts it in your bones. And it can take, there have been research on like the people that have calcified aortas from inflammation in their heart, and the K2 will take that out. It takes calcium deposits out of the tissues, the soft tissues, and puts it in the bones. So then everything functions better again. So in that sense, yes, vitamin K2 will help your circulation.
And that's why you put the K2 in with synochroma because of the vitamin D3, because there have been studies with too much vitamin D can lead to calcium issues. But when you add the K2, that pretty much fixes that.
Exactly.
Yeah.
All right.
Did you get Krish's question, Leslie? You have that one?
I'm working my way down there with so many questions. Yes.
I've got it here if you want me to read it.
Go ahead.
Okay.
Perfect.
All right. Krish says, I've been taking the healthy gut support and benefiting from it. There's less gas and stomach. The stomach is flat. In an earlier webinar, in response to my question, you emphasized the importance of butyric acid. I've started taking sodium butyrate and getting additional benefit with gut health. The sodium butyrate, however, has lots of sodium. And let me know whether once is enough along with the gut health. I'm taking healthy gut once with butyrate after a meal and another without butyrate. Is this okay?
Yeah, that's fine. That's fine. The amount of sodium in the sodium butyrate is really small compared to like what you might sprinkle putting salt on, or if you eat like chips with salt on them, stuff like that. Yes, there is sodium in it, but you know what? Sodium is not a bad guy. We actually need a lot of sodium, and I have more people who are low in sodium than high in sodium, because all these people on low sodium diets, and they're drinking a gallon of water a day, and that gallon of water is taking all the sodium out of their system like it's supposed to do. That's why they say to drink a lot of water. But they're not salting anything, and so they're not getting enough sodium, and so they have low sodium, and they're up all night peeing all the time. You know what? A good kidney can handle about 40 grams. That's 40 grams. That's 40,000 milligrams of sodium a day. So it's not, these small amounts of sodium aren't going to make any difference at all. You're good.
All right. Mark says, I have a discoloration of skin in my lower legs, and it looks like a permanent tan. I still have feeling in my feet. The doctor checked, and I have a strong pulse down there. I do have some tingling in my feet. I'm on insulin. Can this be reversed?
Oh, excellent question. Okay. That melasma, that coloration, the discoloration, it comes from inflammation. It comes from a lack of circulation in the skin specifically. And you can find it in various areas of the body. It's often seen like in the underarms. It can be seen on the face sometimes, or the lower legs. It's usually people who have melanin in their skin. So people who have darker skin will tend to have it much more than people who have very light skin and don't have a lot of melanin. So can it be reversed? Well, yes, in a way, partially. The top layers of skin as they come out can be normal. But the fact that you have neuropathy tells us what's going on is a lack of circulation. So it's caused by lack of circulation or intermittent or irregular circulation. So all of the things we talked about for wound care are exactly the things you need to do to get rid of that.
Great. I hear you say eat a lot of fiber. My experience is that fiber and metformin do not mix well. What is the solution?
What? Why doesn't metformin mix with fiber? I don't know. Gosh, you got me stumped there. I don't know. What's the problem? You should be able to take metformin with food, and fiber should be okay. I don't know.
Okay. Question from William. I had a blood panel drawn on Monday and just got the results. My fasting glucose was 93 and my triglycerides were 88. I was really looking forward to my A1C, but they didn't check it. My question is, why did my VLDL cholesterol go down from 23 to 16, but my LDL went up from 114 to 128? And my HDL went down from 44 to 38.
Okay. Thank you for that question. Okay. So this is a lab question. And if you look at all those numbers, they're very close within 10%. So, well, not quite 10, it's a little more than that. But there isn't that much variation in those numbers. In other words, those are essentially the same numbers, because at any given moment, your triglycerides are going to be a little higher, a little lower, a little higher, a little lower. You eat some, and they go way up, and then they drop down. And so there isn't. So all of these numbers, the VLDL, the HDL, these are not consistent. They're not like in a very narrow range. They're in a fairly wide range, depending on diet, depending on metabolism, depending on whether you're using fat or sugar for energy. So the numbers that I'm hearing are not significantly changed. They're actually within the expected range that you would want to have it anyway.
Today's Fixed Blood Sugar webinar is sponsored by Synachroma, our best-selling advanced blood sugar support formula. Now, thousands of people around the world are taking Synachroma every day as part of their program to fix their blood sugar using natural ingredients that simply work. Now, Dr. Saunders formulated Synachroma to meet key nutritional deficiencies that most people have unknowingly suffered from for far too long. With Synachroma, you get a blend of 6 key ingredients. The perfect combination of chromium, vitamin D3, and vitamin K2, which it's important to take those two together, selenium, vanadium, and our 10-to-1 cinnamon bark extract. Now, if you're not already using Synachroma, I highly recommend that you give it a try and see how it helps your energy, your weight, and your blood sugar numbers. You can get Synachroma at bartonnutrition.com or on Amazon. If you get it at bartonnutrition.com, you can enter the coupon code webinar25 and you'll save 25% off at bartonnutrition.com. But I realize some people like to go to Amazon as well. So anyways, Synachroma, highly recommend. Now let's get you back to the Fixed Blood Sugar webinar.
I know you need to go. And so thank you again for being here, Dr. Saunders.
Yes,
you're welcome.
Too.
My pleasure.
Yeah, thank you. See you.
All right.
Saunders.
Take care.
All right. Well, this has been awesome. Yeah.
I was just going to say, there's just a question here from Anku about xylitol. And actually, if you go to bartonwebinar.com, Dr. Saunders does talk about sugar substitutes and his thoughts on them. So I'm just going to direct you there. There's a lot of really good questions that are answered on that homepage of bartonwebinar.com. So check those out.
Yeah. Xylitol is a sugar alcohol, which means your body can't process it, but it tastes the sweet, but then it goes right through your digestive tract. And for some people, myself included, it causes a lot of gas and bloating and stuff like that. So I tend to avoid that, but it's probably something you can try and see. I would, be measuring your blood sugar levels with that, because Dr. Saunders has talked about how even like stevia or monk fruit or even just the taste of sweet can release insulin and cause problems with that. So, but it's something that, you need to measure that yourself.
Mason had said, can you post the exact name of the cream? And I think you're talking about that. Was it Curamed?
Curaderm, I believe.
Curaderm. Okay.
Yeah, I think it was Curaderm.
Okay.
Yeah. Yep. Our friend Chris said he already ordered some. So
nice.
Yeah, I might have to get some of that as well.
I'm just going to check. I think there was something else on here we could have addressed. So let's see. Mark wondered if we were going to put together a program for those who suffer from diabetes and high blood pressure.
Okay. Well, we already have a high blood pressure program. So if you go to bartonpublishing.com, you can get the blood pressure solution kit. But if you're following the diabetes solution kit, very similar, remedies, I guess you'd say, or program. So if you're lowering your sugar and getting exercise and all those different things that Dr. Saunders talks about for type 2 diabetes is also going to help with your blood pressure as well. So, yeah, and we've covered blood pressure in the past on one of these webinars. So you could find that in our YouTube channel as well. So.
One more question we didn't get to here. Well, there might be more, I guess, but Don asked if there was a better way to exercise for those over 50 and how can we prevent tennis or golfer's elbow during lifting weights? And I don't know exactly what Dr. Saunders' recommendation would be, but the beautiful thing with Google is you honestly can type in exercises to prevent tennis or golfer's elbow during lifting weights, and you will find a ton of stuff. It's really amazing. So try that. But we can ask him as well in the next webinar. And I had posted in the Barton webinar group. It's a Facebook group. There are some really neat things that you can find for free on YouTube as far as exercises, whether you're watching videos. So it's almost like you're walking on beaches through different parts of the world. And you can just be walking in your living room and watching those videos on your screen. There's a lot of really neat things. And so even if some of you on here have some really good recommendations for Don, go ahead and post those here or go to Barton Webinar, the group on Facebook. There are, that'd be a great place to post some of those.
Mm-hmm. Yeah, I know. The other thing I was going to mention is, it's really important. Like I have a doctor locally that I see. He's a chiropractor, but he, like if I've got something going on, I'll talk to Dr. Saunders as well, but it's good to go in sometimes and let someone, lay hands on you in a sense and like, do muscle testing or different things like that. So if you, I would highly recommend just locally find a functional medicine doctor, a functional doctor. They don't have to be an MD necessarily, but like there might be a good chiropractor that you could ask that really, and that's what Dr. Saunders is. He's a functional doctor. Which means they look for the root cause. What is the source of all these problems instead of treating things with Band-Aids, on wounds. That's the old saying that you don't put a Band-Aid on a gaping wound, and then find out the source. So I would just encourage people to try to find somebody in your local area. And if you're working with a doctor that isn't open to some of the things that Dr. Saunders is talking about, it means they're probably steeped in the traditional medicine world, which is all about drugs and surgeries and things like that. But there's just so much stress relief and freedom that comes in working with somebody that really wants to get to the source and the root cause. And so highly recommend that personally. And if you just Google like your local hometown or a larger city towards you and functional doctor, you should hopefully be able to find some people that can help you locally. Because I know Dr. Saunders, he can only help so much. And even his own schedule, like we've given his office number out before, but he's like swamped, and one guy can only handle so much. So, but anyways, yeah. Also just wanted to say, if you're watching this recording on YouTube, thank you. And you can join us live if you go to bartonwebinar.com. You can register with your email address and we'll send out an email reminder before our Thursdays at 11 a.m. Central Time. And also on YouTube, we'd love to have you click that like button and subscribe to our channel and just go to our YouTube channel and look at the archived recordings. I think this is number 106 now that we're on. And yeah, a lot of, lots of great topics covered in the past. So if you've got remaining questions, you usually can go and find it somewhere on our YouTube channel as well. So, but yeah, that's about it. Anything else come in?
I don't think so.
All right.
Yeah.
Awesome. Well, this has been really good. Thanks, Leslie.
Yeah. Thank you. We'll see you guys next week. Same time,
Thanks,
same
everyone.
place.
Yep. Bye, everyone. God bless.